Hi, I'm Dr. Kushalappa, shoulder and elbow consultant at Narayana Health, Bangalore. And today I'm going to be talking about shoulder instability. Shoulder instability is a condition in which the shoulder joint dislocates or basically comes out of socket. Now, the shoulder joint in general is a ball and a socket joint, and it is quite amazing in the sense that it's a very small socket in which a very small ball sits, and this gives us a large range of motion. But at the same time, we're able to keep the joint in place while doing heavy sort of activities. Consider playing badminton, consider lifting weights overhead. And this is all achieved through the ligaments that we have that provide us static stability, and also the muscles that we have that provide us dynamic stability. Now, shoulder instability is a condition in which there is a compromise in this static stability. Now, the compromise in the static stability can result from a number of reasons, the most common being a trauma. So let's say you have a fall, and after you have a fall, you dislocate your shoulder. Now, that results in a tearing or damage to the ligaments in the front of the shoulder, and hence the shoulder comes out the front of the joint. Now, when this happens, it results in what we call a Bankart lesion. And as the shoulder comes out of joint, the head tends to impact back onto the socket, resulting in what we call a Hill-Sachs lesion. And this in combination compromises the stability of your shoulder joint. The same situation can happen in the posterior direction, which most commonly happens in patients who have a seizure disorder. So when you have a seizure and you have a fit that's a bit uncontrollable, your shoulder has a tendency to come out the back of the shoulder, resulting in a reverse Bankart or a reverse Hill-Sachs lesion as well. Now, when we look at shoulder instability, we try and manage the patient as a whole. And we classify the risk, or we look at the risk stratification to understand the risk you have to dislocate your shoulder in the future once again. And we look at multiple parameters such as age. We look at the side that you've dislocated, whether it's your dominant or non-dominant side. We look at gender as well, and we look at your occupational demand and in addition to that, your activity demand. Taking all of these things into consideration, we at Narayana come up with a treatment plan for you. And that might be something as simple as physiotherapy, which is aimed at regaining your movement and regaining your stability by taking or harnessing your dynamic stability, which is your muscles, or it may require you to undergo a surgical procedure. Now, based on the kind of injury you have, this surgical procedure might be keyhole or arthroscopic, or it might be open or reconstructive. In a keyhole procedure, our main goals are to basically take the tissue that you've torn and put them back to where they're meant to be. This requires a period of rest, which is roughly about 6 weeks, that you take relatively ease in your activities, followed by extensive rehab, and we aim to get you back to your sport roughly in around 6 months' time. In terms of an open procedure, we're doing something that we classify as non-anatomic, in which we're taking a piece of bone from the front of your shoulder and changing the position, which is called the latter J procedure. And in this procedure, we give you good stability to your shoulder and make it near indestructible and send you back onto your sporting journey going forward. That's our goal at Narayana, to get you back onto your feet and onto the field and have an active lifestyle.